There has been an increase in the cases of respiratory and influenza-like illnesses in the country. The health department says there have been 4 cases of Mycoplasma pneumoniae or walking pneumonia. One recorded in January, another one in July, and 2 more in September. The agency says the persons who tested positive for the disease experienced influenza-like illnesses. Pediatric infectious diseases expert Dr. Ana Ong Lim says,
yung kaso ng influenza-like illness ay tumaas kumpara dun sa nakaraang taon. So this is about 50% increase. May pangilan-ngilan din na Mycoplasma pneumonia pero it's a very, very small number. Kahit na mas maraming kaso tayong na-observe ngayon, hindi sila mga mikrobyo na kakaiba or never pa natin nakita before.
the World Health Organization or WHO says walking pneumonia is a mild bacterial infection that resembles a cold. According to the DOH, this disease is not new to the Philippines. It adds there is no outbreak of walking pneumonia in the country and that there's nothing to be alarmed about amid the rising cases in China. Ron Ginsolante, president of the Philippine College of Physicians, says,
I think we need to tone down that panic or fear that the walking pneumonia is increasing. These are the months that we see a lot of respiratory illnesses, whether it's bacterial or viral. The cases are still manageable. Even the hospitalization rate of this common influenza-like illness are not so alarming. We don't need a mandatory face mask at this point in time.
the public is advised to take precautions, including isolation when experiencing symptoms such as cough, sneezing, fever, and sore throat.
If they have fever, then they can take the paracetamol. But most important here is they have to rest because your body needs to recover.
Experts say vaccination is also key to preventing influenza-like illnesses and pneumonia.
Kung naaayon sa ating age and health status, meron talagang mga bakuna na kailangan nating matanggap to be able to avoid respiratory illnesses like flu or some kinds of pneumonia.
We need to, again, advocate for vaccination, especially for flu vaccination, pneumococcal vaccination, particularly for the vulnerable population, because these are some of this, like your influenza, is vaccine preventable. Your bacterial pneumonia is also vaccine preventable.
EJ Gomez, CNN Philippines.